It's quite late, but I'm sure some of you have some questions. So I think is it time for Dr. Russo to come back up, and we'll have a little question and answer panel until we decide it's time to go home. Does that work? All right. Well, while Dr. Russo is making his way up here, I just wanted to give a very special thanks to Prentice for putting this event on to his own expense. This is, as you know from walking through the wide open door tonight, nobody made money off of this event, and it clearly cost money. And I really am so grateful for Prentice to put this on. This is something that we see frequently in the medical cannabis community, this type of altruistic behavior where we know that we can do something to help people, and so we make it happen one way or another. So thank you to Prentice, thank you to Denny, and to all of the sponsors here tonight. Those folks over there with the food, to the AV people here. I mean, a lot of people came together because they believe in this and know that this can work, and they made this happen. So hopefully there'll be many more. Thank you so much, Prentice.
Thanks, and most welcome. And like I said, the doctors are free to answer any questions that you might have. Mike, you could give them the mobile mic. Make the mobile mic.
We're not able to see you, so.
Right. All we see is the light. Look.
Maybe we can turn that off, the spot. Anyone have any questions?
So we have legal, the ability to import the oils now, as I understand it?
Yes, under Cayman law, we're legal to import, but only a pharmacist or a doctor. It's not legal for the general public. So you have to get a doctor to write a prescription, and the pharmacist to fill it.
Right. And who would our local best practitioners be in that sense? Do we have anybody in the sort of the forefront of that?
She just left. I heard someone say she just left.
What's her name? Dr. Osterloh. Thank you.
There's one more thing as well. Basically, under Cayman law, when a doctor writes a prescription for cannabis, it has to be for someone that's under their care. So just keep that little minor detail in mind.
Any other questions?
Thank you. Welcome back, Dustin. Great to see you again since you're a child. Listen, one of my questions was that, is there any place of doing either blood tests on the levels of the THC or CBD to correlate with the response of a patient in terms of their, response to pain or to any of the other nausea, vomiting? Is there a place to use blood tests to monitor them?
Actually, the correlations are very poor, and I would recommend against such an exercise. I can tell you in the development program for Sativex, almost every country and clinical trial required some kind of monitoring of that. The correlations between the levels in the blood and the clinical result were very poor. So it's an unnecessary exercise. So this is very different, say, compared to anticonvulsants, where they may have a therapeutic range where you want to aim. So sometimes there'll be correlations, sometimes there won't. The same thing applies to impairment. In the States, various ones have certain levels in the blood, what are called per se rules. They say at a certain level, that if you have this, you're by definition impaired and convicted, which may not be true. It depends on the person's tolerance. Generally, when this comes up in new protocols for a clinical trial, I would recommend against anything beyond the minimum that the regulatory body will accept as testing. it just isn't a good correlation. So this is different to other drugs.
So mainly you just use what your patient starts off with telling you how they feel with their pain, and realistically say we're treating chronic pain. Would you have a certain level is there a questionnaire that one can use
Right.
to?
No, the
help
correct
us?
dose is the lowest dose that's going to provide relief to the symptom. And a dose below that, which is going to produce untoward side effects.
So the
That's
role
the
of the
correct dose.
clinician is typically to give a starting dose and then a methodical titration schedule. And it's been well established that patients are able to titrate this themselves.
Right, and it's much quicker than a lot of drugs. Many of the drugs we use for pain, anticonvulsants and antidepressants, it can take weeks to get an effective dose, if at all. Generally speaking, the patient can determine a dose for their condition within a couple of weeks at most, and sometimes quite a bit less. So that's something remarkable about this.
You know?
So the slides that you guys showed where it sort of broke down the different terpenes, I think it was, the different bits, you know, with the I think you had the colored slides or the where it had all the different bars of the different parts to it, the different effects. Terpines, I think maybe it was called or something. Anyway, my question really is in sense of that, obviously there is a way to test those things. Is there any manufacturer out there that's producing it with those graphs with it, saying this is this much of this and this much of this? I've
Right.
seen in the dispensaries.
The THC.
I was
Right.
recently in
Um,
Denver. I did see some.
Well, the point is, yes, it exists. You saw some examples. I think that consumers have to ask for this. In an ideal situation, this would be a necessity, that it would be mandated that this kind of information is available to the consumer and the physician that might be recommending them. That would be the ideal situation. I can tell you that the ideal situation exists right now in very few places. But we should always strive for better. And for patient care, I believe that this kind of information is necessary to every patient. So I would hope that people would advocate for this kind of information to be available. Now, there's another way of looking at it. It's a growth industry for the people that do analyses. Maybe we need a whole generation of people on Cayman that are doing analytical chemistry on cannabis. But quite seriously, this is important information to understand the effects of a particular kind of cannabis.
Now, there's very few states in the U.S. where a pharmacist is involved in the dispensing of cannabis, and I think that's one of the real strengths of the program here, is that you'll have that oversight of a pharmacy and a pharmacist to hopefully recognize the importance of having those results available for the different products that are in whatever formulary they build on their shelf. And where I'm practicing in Maine, patients typically have to go purchase the medicine, then they bring it to our lab to test it themselves. The burden often falls on the patients. Then they find out what they have, is it the right product or not, and it's this kind of back and forth. It would be amazing here if a clinician could know, this is what the pharmacy has in stock. These are the profiles of the various formulas. I'm going to select this one for this patient. It's a good match.
And so how do you go about getting those profiles? What's
How
the
do-
process?
How do you get the reports?
Is it really
Yeah,
expensive?
there's basically two pieces of equipment that are needed. One's high-performance liquid chromatography. The other is gas chromatography. These are well-known analytic, equipment. So any organic kind of lab that does analytics would have them. They would just have to be specifically calibrated to look for these compounds.
And it's not a simple matter. There are a lot of labs producing very poor results. You need someone who's trained and also is scrupulous. There have been many labs producing bad results, and they need to be accurate. There need to be scientific standards. The labs can be certified to producing quality work. So again, it's a matter of consumers insisting on this level of oversight and the ability to have this information. But the equipment exists, the people that know how to use it exist. It's a matter of making it more available.
Is there any kind of training programs for that kind
Oh,
of
sure, but
industry?
it's not it's not a course in gas
Specialized.
chromatography for dummies over a weekend. There are people that offer these, but that's not enough. This is serious stuff. It really requires some training, and you need good standards. You need examples of the drug that are of known quality and quantity to compare so you get accurate results. It is not simple. However, I think it is necessary.
Yeah.
Thank you.
Well, I would just say that some of the oils that we're looking in the port, one of the pharmacists, they required that a certificate was be done, and it was done by the University of West Indies. So it will be tested, and that should be available.
And I would just add, excuse me, before the next question, like Dr. Russo pointed out, it's not just the active components that we need to be testing for, it's the contaminants as well. We don't want to be putting those pesticides and other contaminants, even natural contaminants like mold toxins, right? This is a high humidity area.
Yeah.
If a cannabis producer has a big crop that gets moldy, they suddenly have two choices, right? One is to throw it out because no one's going to want to buy that and smoke it, or they could process it into an oil, say, and no one will know that it's moldy, except that people will get sick because those mycotoxins are quite toxic, and they would be present in the final material, so they have to be ruled out as well. Next question, please.
Okay, I would like to first say thanks for those informative information. I am presently studying healthcare management with a specialty in medical coding. I want to know if there is a code that is assigned to medical cannabis already. Is it being reimbursed for?
No, so that's a great question. In my practice, we use just all the traditional codes for an office visit and traditional diagnosis
So
codes.
no ICPICS code is assigned to this drug?
No, I don't believe that there is, because it's not considered a prescribed medicine in the United States. It's considered a recommendation for an herbal treatment.
Yeah, while we're at it, since we really didn't discuss this, what's the standard of care for cannabis-based medicine? Well, that's an easy one. It's the same as for any medical specialty. What is required in a cannabis consultation is spending some time with the patient. You need a history, a physical, preferably records. You need documentation. You need to indicate that you discuss the pros and cons of cannabis usage with the patient, and it needs to be in the chart. You need to follow up. These are all the regular standards of care, so it's no different from what properly should be done with any patient. Again, there are a lot of cannabis clinics out there where you spend 5 minutes with somebody who obviously doesn't care a lot. You get your recommendation and you go to the dispensary all happy, but that's not good medicine.
But I will add this, and thank you for reminding me of it. We had discussed it, but not brought it up during our lectures. It would be a great idea for Cayman to have an observational research arm to this cannabis program that's been developed here, where patient-related outcomes could be tracked over time, and I imagine having some codes for that could make it easier. But this is something where it could be done right at the pharmacy quite readily.
So is it then you're saying, like for the regular visit, there could be a code, but not for the medicine itself, not for the prescription itself? Okay, thank you.
Thank you.